Thank you for choosing AngioDynamics as your industry partner to support the delivery of high-quality patient care. The following product demonstrations have been developed as a resource for easily accessible product information to support your clinical practice. The AngioDynamics BioFlo PICC with Indexo technology and the AngioDynamics BioFlo PICC with Indexo and passive valve technology are indicated for short or long-term peripheral access to the central venous system for intravenous therapy, including, but not limited to, the administration of fluids, medications, nutrients, the sampling of blood, and for central venous pressure monitoring for non-valved lumens. Also for power injection of contrast media. Please refer to the product instructions for use for full prescribing and risk information. The following care and maintenance tutorial is applicable to the AngioDynamics BioFlo PICC with Indexo technology and the AngioDynamics BioFlo PICC with Indexo and passive valve technology. PICC specifications will vary according to the specific size and model of the PICC included in the kit. It is recommended that institutional protocols be followed for all aspects of catheter care, use, and maintenance. The following care, use, and maintenance information is not intended as a substitute for institutional protocol, but rather to describe guidelines and recommendations that can be used successfully with the BioFlo PICC with Indexo technology. The purpose of this presentation is to review care and maintenance techniques and recommendations for the BioFlo PICC with Indexo technology and the BioFlo PICC with Indexo and passive valve technology specific to catheter, hub, and lure cleaning and disinfection, application of needleless connectors, cleaning and disinfection of needleless connectors, connection and disconnection of IV tubing and syringes, and flushing and locking of the catheter. First, let's review the rationale for hub cleaning and disinfection. Every port of the IV access device, including all injection ports, needleless connectors, and the hub of the catheter itself, are potential portals for entry of infectious organisms. Scrubbing the hub is then important to prevent intraluminal contamination. Adequate scrubbing depends upon the agent used, appropriate contact and drying time, and friction. To adequately scrub the hub, the clinician should perform hand hygiene, don clean or sterile gloves, and use a scrubbing device with an alcohol product such as chlorhexidine with alcohol or 70% alcohol to disinfect the catheter, hub, and stopcocks. Note, do not use the catheter with chemicals that are incompatible with any of its materials of construction. Such agents include acetone and polyethylene glycol containing agents. Now let's review the remaining steps of this technique. First, grasp the catheter hub, not the catheter or extension tubing, to stabilize the hub for disinfection. If using a pad, make sure you don't contaminate it before use and only use one pad per hub. Note, prep pads should never be reused. Rub for 10 to 15 seconds, unless directed otherwise by the manufacturer's instructions, generating friction by scrubbing in a twisting motion. Make sure that you scrub the top of the hub well, not just the sides. Allow the hub to dry completely. Note, prevent the hub from touching anything while drying. Objective 2. Application of needleless connectors. It is recommended that only lure lock accessories be used with the BioFlo PICC with Indexo technology. Refer to the applicable product directions for use for all devices and accessory used in conjunction with the BioFlo PICC. When applying a needleless connector, first ensure that the catheter hub has been disinfected appropriately as reviewed in the previous section. Remove the needleless connector from the package, ensuring that the portion of the connector that comes in contact with the PICC hub and fluid pathway remains sterile. Prime the needleless connector in accordance with the product DFU and/or institutional policies and procedures. Note, priming with infusates rather than normal saline for injection may lead to infusate remaining in the lures of the needleless connector. This residual infusate in the lures may impact the ability to easily remove the needleless connector. Note, do not use hemostats to secure or remove devices with lure lock hub connections. While holding the hub of the catheter steady, apply the needleless connector. Be sure not to hold the extension set. Twist the connector onto the catheter hub to engage the lower connection. During this procedure, notice that the catheter remains stationary. Objective 3. Cleaning and disinfection of the needleless connector. Prior to making a connection of any tubing, syringe, or IV accessory, the needleless connector should be disinfected. Please refer to the manufacturer's directions for use for specific instructions. Generally, to adequately scrub the hub, the technique should be as follows. Perform hand hygiene. Don clean or sterile gloves, referring to institutional protocol, and use a scrubbing device with an alcohol product such as chlorhexidine with alcohol or 70% alcohol to disinfect catheter hubs and stopcocks. Grasp the needleless connector rather than the catheter hub to stabilize for the next step. Rub for 10 to 15 seconds unless directed otherwise by the manufacturer's instruction, generating friction by scrubbing in a twisting motion. Notice in this demonstration that there is no twisting of the catheter or the needleless connector. This could result in over-tightening of the connector onto the catheter hub. Repeated over-tightening may reduce the hub connector life. Make sure you scrub the top of the hub well, not just the sides. And again, allow the hub to dry completely. Note, prevent the hub from touching anything while drying. Objective 4. Connection and disconnection of IV tubing and syringes. Once the needleless connector has been disinfected, application of IV tubing, syringes, or other IV accessories can be performed. Grasp the needleless connector rather than the catheter hub to prepare to make the lower connection. While holding the needleless connector stable, twist the applicable component onto the needleless connector. Do not hold the catheter hub while connecting syringes or other components, as this may cause over-tightening of the lower connection. Again, repeated over-tightening may reduce the hub connector life. Objective 5. Flushing and locking of the catheter. It is important to effectively clear the needleless connector, the PICC hub, and the catheter of infusates and blood components after use, and to flush or lock the catheter when not in use. The previous sections detail the process for catheter hub disinfection, needleless connector disinfection, and syringe attachment that should be implemented as part of the following flushing and locking instructions. Flush the BioFlo PICC catheter with passive valve technology after every use or at least every 7 days when not in use to maintain patency. Use a 10 ml syringe or larger. Flush the catheter with a minimum of 10 ml of sterile normal saline using a pulse or stop-start technique. If using a different procedure, the use of heparin may be necessary. Follow institutional protocol for catheter flushing. Flush the BioFlo PICC non-valved clamped catheter after every use. Use a 10 ml syringe or larger. When not in use, flush at least every 12 hours with a minimum of 10 ml of sterile normal saline, using a pulse or stop-start technique, and lock with heparinized saline in an amount equal or greater than the catheter priming volume or according to institutional policy to maintain patency. Thank you for viewing this tutorial. We hope that this information supports your efforts to deliver high-quality care to the patients that you serve.